Nurses, the backbone of the health service, have endured 4 years of strict pay restraint and now have another 4 years of it ahead. For many, doing exhausting overtime or extra agency work has become the only way to make ends meet. And the new head of the Royal College of Nursing has told 5 News that is putting patient care at risk.
A tired nurse is not going to give quite the same level of care, and that's very worrying, that when nurses are very tired they may not have that same positive contact with patients. And also, you have to make very quick decisions as a nurse, and you have to be sharp and understand what you're doing. So when people are tired, it's much easier to make mistakes.
The government's new priority is to extend 7-day working across more of the NHS in England. Nurses fear that could mean cuts to the extra payments they get for weekends and nights. And Davies warns removing that source of income could prompt a mass exodus from the profession.
If it was to be removed, that would be absolutely devastating, and nurses wouldn't be able to afford to continue to work, some of them. My biggest worry is that nurses would walk permanently, that they would choose a different career, they'd choose a different job, because it would just be unaffordable.
The mid-staff scandal exposed that up to 1,200 patients had died through appalling care at Stafford Hospital. Ever since, there has been a national focus on recruiting more nurses. But now that trusts are slipping into the red, the old problem of nurse shortages on wards is returning.
There's a nervousness that the wake of mid-staff is beginning to get nibbled at. We do need to keep an eye on this and make sure that we don't get to the levels that we had before, which are positively dangerous. Obviously, we have got that perfect storm at the moment, which could get worse if we don't see nurses being valued and getting a good level of pay.
The national negotiations that determine the salaries of England's nurses for next year are about to begin. Ministers cannot afford to ignore their concerns.